Thank you for the opportunity. Ceann Comhairle, like others in this House, I would like to begin by expressing my own solidarity and that of the Labour Party with everyone who's been affected by the coronavirus, especially those who are ill right now, those who are in the front line of providing health and social care in retail, in transport and logistics, in policing, and the amazing 30,000 plus people who have volunteered to support our health services in this time of national crisis. People have shown extraordinary resolution in the way that they have cooperated with social distancing and other life-altering advice, important, urgent advice that we've received from our health authorities. Nobody would have thought it possible how quickly our people have adapted. And people have demonstrated a tremendous, warm community spirit in the way that they've reached out to support those who are vulnerable, including finding innovative ways for helping people without breaking the new rules of social distancing. Today, as a society, we have greater scientific knowledge and research facilities to work on vaccines, to work on treatments. We have much improved hygiene, and we are part of unprecedented global cooperation. We can and we will, Cathaoirleach, defeat this disease. But everyone must play their part, not least vital measures such as social distancing, rigorous hand washing and social isolation. These are matters that are crucially important. The Government's Health Prevention and Protection and Other Emergency Measures of the Public Interest Bill 2020 is yet another vital part in our national effort to challenge and overcome this menacing coronavirus. The Labour Party will support this bill because we support the objectives the bill is trying to achieve. But we do believe that the bill can be improved. And I hope and I believe from what the Minister for Health has said in his opening remarks that he will carefully consider suggestions from across this House today, in the short time we have, on measures to improve this bill. The Labour Party, like others, confined ourselves in the numbers of amendments we tabled. We tabled simply 2, and I'll set out what those amendments are at a later stage. In addition, we have other concerns about the bill. There are serious differences in terminology between the Social Welfare Act amendments and the Health Act 1947 amendments that are welded together in this bill. The Social Welfare Act amendments confer entitlements on those who are diagnosed as actually having COVID-19 or who are probable sources of infection or who have been formally detained. The health part of the bill deals more broadly with powers in respect of persons who have a potential source of infection. Many of those who are self-isolating at home at the moment, in line with the HSE advice, are doing so because they are potential sources rather than probable sources of infection. Probable means more likely than not. A GP could not diagnose someone as a probable source of infection unless they had been in close contact with a confirmed case or were showing signs and symptoms of the disease. If they are merely potential sources of infection and have not been notified that they are probable sources, they are nonetheless now, all of us would be if we thought we were potential sources, would be in isolation, because that's the formal advice we've received. And it appears from the bill that these category of people would not be covered by the Social Welfare Act amendments. It doesn't seem to extend to them. We need to know the thinking behind having entitlements confined to probable sources, but powers extended to potential sources. It may be that people who are away from their jobs will fall into the gap created by having 2 separate definitions under this Act. So I just want you to explain, Minister Taoiseach, the reasons for the deviation in these 2 terms. Could we simply use the term potential in all cases to remove the possibility of creating any ambiguity in the law? On another technical point, which may be a flaw in the bill as drafted, can the Government confirm whether or not the new offence of contravention of a regulation under the new section is an arrestable offence? Nothing in the original Act, nor in this bill, seems to make the new offences an arrestable offence, which would mean that the Gardaí would be very limited in their actual powers to enforce it, because if they wanted to stop somebody from contaminating, there's no point in saying we'll serve a summons on you. But the powers to actually arrest are not conferred on guards in this. They're conferred on medical officers of health. Section 11 brings in a new Section 38A in the 47 Act to allow for the forced detentions of persons who are not self-isolated. As currently worded, this requires a medical officer to believe in good faith that the detention is appropriate. However, the bill should also provide that the medical officer in question must have reasonable grounds for making that decision. That's currently not in the section. Gardaí have various powers of arrest, but must have reasonable grounds for exercising those powers. Subsections 5 and 6 of the new Section 38A, inserted by Section 11 of this bill, provide for a review that is triggered at the request of a detained person. There is no provision that persons must be informed of their right to this review, and I think that is something that we should add. Subsection 4 of Section 38A says that the detention must be kept under review and that a medical examination must be carried out no later than 14 days after the date of detention. Section 1D of Section 38A states that the detention continues until such time as a medical officer certifies that a person's detention is no longer required. We need to ensure that the section should state that the medical officer who ordered the initial detention must receive a report on such examination and review whether the detention is later still appropriate. These are matters that in the normal course of debate we'd have time to tease out in detail, but we won't have time here. I'm anxious to give time to my colleague, so I want to add one final additional plea to government. Local radio is a vital source of information, and others have talked in terms of misinformation, particularly on social media. People, certainly in my own constituency of Wexford, listen to South East Radio as an authoritative voice of truth and advice. Due to the current crisis, many businesses have pulled away their ads, and those local radio stations are now on incredible pressure. They're actually already losing jobs. So can I end my contribution by asking the government to please, in the panoply of support that's been given, include local radio. A small amount of money is required to ensure that this vital lifeline remains operational in the crisis period ahead.